Have you ever wondered if your knees are moving as well as they need to? Today, we're breaking down exactly how much knee range of motion you need to live an active, healthy, and fulfilling life. My name is Dr. John Schaefer. I'm a physical therapist, strength conditioning coach, and I'm board certified in orthopedics. I've helped hundreds of people, both in person and online, overcome their knee pain, and I want to help you do the same. In today's video, we're going to cover how much range of motion you need to do all the things you love, why range of motion is important to focus on, as well as some different tips and tricks for how to improve your range of motion. Because I think we all know that, the knees need to move well in order for you to be able to do all the things you love, but we don't necessarily always understand how to improve that. So I want to make things crystal clear and let's get you moving. So I think it's helpful to start with understanding what the typical ranges of motion are. I'm going to use my model here. It doesn't bend extremely well, so I'll also use my arms as a knee model as well. So when you think about the bending of the knee, typical ranges that we tell our patients are between 120 and 135 degrees. So if you think about 90 degrees, that's being able to squat to about parallel. And to have full, healthy knee range of motion, we want you to be able to go even further than that. And we'll go over some different tests for how you can actually assess your range of motion at home a little bit later on. But it's helpful to note that when it comes to bending your knee, you should be able to get to that 120, 135 range. And then in some cases, we'll see individuals who can get all the way to 145, and that could be like bringing your heel to your butt. On the other hand, we have to look at extension or straightening of the knee. So, how well are you able to extend that knee straight out? Are you able to straighten all the way without having a little bit of bend, or do you hit a stopping point when you try and straighten that knee? When it comes to straightening the knee, we want to get to at least 0 degrees. Some people actually have hyperextension, meaning they'll go past 0 degrees and their knee will actually come backwards a little bit, creating what looks like a little bit of a strange angle when the individual's standing, but it's totally normal. And a large portion of the population actually has a little bit of hyperextension. So all this in terms of range of motion, what's normal, what's not, it's going to depend on a variety of factors, including age. As we age, especially if we're not working on our range of motion consistently, we will lose some of that motion. So it's normal as people age that they'll start to lose a little bit of that motion, but it doesn't have to be the case. If you work on your motion consistently, you have full range of motion for life. But unfortunately, not a lot of people will focus on that motion as they age. Next, if there's any kind of injury to the area that can affect the individual's range of motion, some common reasons for this is when the muscles are injured or there's injury to the area, the body starts to guard, meaning some of the muscles might tighten up and they might get into a protective state in which they won't allow the knee to move through its full range of motion. This is your body's defense mechanism. So again, this is normal following injury, but if it's not addressed, this is what can lead to a long-term issues with range of motion. And then also just thinking about situations that are post-surgical. So say you have a knee replacement, knee arthroscopic procedure where they go in and clean things out. After that, you might also notice a little bit of a decrease in your range of motion as well. And it's just important that following that surgery, you progress your motion gradually over time. Because if you don't, that's where we start to run into issues where people lose range of motion and things like that. And if you want to maintain motion, have healthy knees following any kind of procedure, super, super, super important that you're rehabbing and focusing on that motion. And then lastly, I touched on this just a little bit already, but your activity levels over time can determine how much motion you'll have at the knee. So if you are someone who's super active and taking your knee through those different ranges of motion on a daily basis, you're much more likely to maintain that motion for a long period of time compared to if you're someone who's a little bit more sedentary, is not getting up, moving around. In those cases, you're going to have a harder time maintaining that motion if you're not taking the joint through those ranges on a daily basis. So next, it's important to think about, why does having the range of motion matter? Who cares? Well, let's go through just some everyday activities and what type of motion they require. So walking requires about 60 degrees of flexion. So I'm going to get my model here. Um, so 60 degrees, that's not a whole lot. So bending, straightening as you walk. Most people are able to maintain plenty of motion and walk throughout, their entire life without having to think too much about it. The next is climbing stairs. So if you start to walk up and down stairs, you're going to need a little bit more. You're going to need 90 degrees. So thinking that you're able to bend the knee to where it's parallel with the ground. This is where we start to see, a lot of people will mention difficulty as they age climbing up and down stairs. Part of that could be due to motion limitations, or if they're not walking up and down stairs frequently, maybe they're taking the elevator, maybe they don't have steps in their house. So when they do start to work on stairs, that can put a little bit of excess stress on the knee. Getting up and down from a chair, that's similar. It's around 90 degrees, depending on the depth of the chair, it might be even lower, so closer to 100. You'll hear a lot of people say, as they get older, it's harder and harder to get out from a chair, especially if you're not working on strengthening those muscles, and especially if you're not going through those ranges of motion outside of getting up and down from the chair. So those are kind of base level everyday activities and what sorts of ranges of motion are required. Once we get into sports and hobbies, these are things like biking, cycling, hiking, doing things, that you love with your kids, grandkids. Um, all those activities can require a much larger range of motion, oftentimes 120 degrees or more. So if you want to continue to do those types of things, you really need to be working on making sure that, you have that range of motion, that you're going through those motions frequently. And if you're having difficulty with those activities, it might not be a bad place to start to assess your range of motion and ask yourself, am I lacking in this area? And is that what's making things difficult when you try and do those tasks? So let's next talk about assessing your knee range of motion. So if you're doing this at home, super, super easy. The first self test is for knee flexion, or again, that bending of the knee. All you're going to do is sit and bend your knee as far back as possible, pulling at your ankle, pulling as close towards your hips as you can. And really, you should be about 1 foot length away from the back of your heel to your hips. That's a pretty good indicator if you're, doing well from a motion standpoint. If you wanted to get a more precise measurement, there's lots of different phone apps where you just take a picture and it'll measure for you, or you could get a goniometer and get a measurement yourself. That's what I would do as a physical therapist. But that's a good way to do a quick, just dirty assessment of how much bending motion you have at the knee. The next is going to be extension or straightening of the knee. So for extension, you're going to sit on the floor and see if your knee straightens completely. A good way to measure this is all you're going to do is slide your hand underneath. And if your knee is raised up, you can't straighten all the way. There's going to be some space between the top of your hand and the bottom of your knee. So just see how much straightening you have, see how easy that is for you. If it is challenging, then that can be a sign that you're lacking some of that full extension. Next, we'll talk just a little bit about why range of motion could be limited. The first, we touched on this just a little bit earlier, is injury. So if you have ligament tears, meniscus damage, your body starts to guard, meaning it's not going to allow you to go through those full ranges of motion. And that's okay right now, because it's something that if you do work on it, you should be able to improve it over time. The next is post-surgical stiffness. So anytime we've got a surgery to the area, anytime that there's any kind of incisions, what that leads to is it puts your body on high alert and again goes into that protective mode. Lastly, general inactivity. So people who are spending a lot of time on the couch, people who aren't very active. Over time, if you're not moving those muscles, not moving those joints through their full range of motion, you'll start to stiffen up. Again, this is something that's correctable, but if you're going for 2, 3, 5, 10 years of decreased activity, that's where it starts to become a little bit more problematic. Some solutions if you are having limited motion in the knee, an active rehab routine, including stretching. So doing things like heel slides. I've got videos on my page for those. Quad stretches can be super helpful. Just working on getting the motion back in the knee. So working on regaining that full extension, full straightening is super, super important. Next, after you do get some of that motion back, working on strengthening through those new ranges of motion. So it's not enough just to have that motion. We got to be strong through those new ranges so that you can do all the activities you love, and everything like that without much of an issue. There is a time and a place to handle this on your own, and there's also a time to seek professional help. So if this is something that's been going on for a prolonged period of time, maybe you've tried some stretching on your own, maybe you're just not seeing the results that you want, then it's time to seek out professional help. And it could be something as easy as scheduling an appointment with a physical therapist who gives you a few different things to work on, and it's just another pair of eyes to give a professional opinion and assessment. And I want to give you just a little bit of a bonus here because I know many of you might be coming off of surgery. So let's talk about following and total knee replacement, what type of knee range of motion you should be looking for. By the end of week one, the goal is to reach at least 90 degrees of bending and be working towards full knee extension. That full knee extension is going to be super, super important to get back very quickly, because if you wait for a longer period of time, it's just going to be harder and harder to get that back. You've really got a short window where you can make a big difference with that range of motion. You've got to be aggressive early on. So, in that case, um, what you're going to want to do is definitely focus on keeping the knee straight. You can maybe put a pillow underneath your heel. Do everything you can to make sure that you're keeping that knee straight, and don't put anything directly underneath your knee that would lead to an angle. Because if that happens, then the muscles start to shorten up behind, and then you'll have a even harder time straightening your knee. At the end of weeks 2 to 3, the goal is to achieve at least 100 degrees of flexion or bending and have full knee extension. And then by weeks 4 to 6, you should be approaching or already have about 110 to 120 degrees of full knee flexion. Really, it depends on what your baseline is, how much motion you have on the other side, but those can be some markers because I know I'm going to get some questions about that. So, just to close here, the knee range of motion, it's essential to daily life and performance, not only the things you're doing day to day, but also the activities and sports you love. So, knowing where you stand and taking steps to improve your motion can make a huge difference because if you have no idea why you're feeling stiff or don't feel great, you could just be thinking, oh, I'm getting old, oh, I'm in pain, but I don't know why. But if you know it's a motion deficit, it's something that's fairly easily correctable. If this is something where you're looking for a little bit more help or want to curious about next steps, I'd invite you to go ahead and download my free knee pain guide in the comments section. And that's got basically a self-assessment that goes a little bit more in depth, some different causes of knee pain and what steps you can take to address it on your own so that you're pain free as soon as tomorrow. If you found this video helpful, like, subscribe, share with someone who you know needs to see this. And I'm going to keep on making great knee content to help you have healthy, strong, long lasting knees and to be able to do all the things you love. Thanks for watching. We'll see you in the next one.